All right, we're just waiting on some people to join now that we're live. Everything good on your end, Gail?
Yep. And
Gotcha. I see the message. Chris, just let me know when we're ready to start. I'm ready whenever you are. I'm going to be running it, Gail, if you can hear me.
Go ahead and introduce. People may come in while we're. This is Mr. Jonathan Rockoff, and he joined the Family Children's Resource Program at the University of North Carolina School of Social Work back in January of 2018. As a training specialist, he facilitates and creates trainings on welfare topics such as responding to child sexual abuse, substance use, trauma, coaching, foster care, and adoption. Mr. Rockoff has more than 15 years of experience working directly with families who have experienced trauma. His in depth expertise on family well being has been shaped by his firsthand experience working with a variety of settings, introducing into home services, juvenile justice, foster care, adoption, and education. He also writes for a nationally recognized publication targeting child welfare professionals and resource parents called Fostering Perspectives. Mr. Rockoff, welcome, and we appreciate you coming in and doing this program. And I'm going to turn it over to you now.
All right. Thank you very much, Chris. I appreciate it. Good morning, everybody. I am here in Raleigh, North Carolina. Pleased to be with you. That was a very nice introduction. Thank you there, Chris. I was wondering who that was about, who you were talking about. I said, oh yeah, that's me. But I'm glad to be here with you all. A little bit more about me specifically. Most of my professional child welfare experience is as a foster care social worker. I also worked in adoption and licensing. So it's definitely an honor to be with you all. I know foster parents and foster care social workers are absolutely some of the most selfless folks out there. So I'm very glad to be here with you all this morning just to talk to you about this very important topic. So I have a presentation for you all here. Hopefully you can see that animation. We got animation in our slides now. There's technology's stepping up. But we, like I said, have this really important topic here. Just have an hour of your time to do so. We know that about 80% of families involved in child welfare have a substance use component. I would argue that number is probably even getting higher, and we'll talk about some of the reasons why that might be. But right off the bat, we know probably about minimum 4 out of the 5 families that you're working with, there is that substance use component to them. So my my goal today, since we just have an hour, and when we train social workers in this topic, this training is 3 days long. I just have 60 minutes. So I have a few goals today. One of them being is just to challenge the way that you think and debunk some different myths here. So um, thankfully, due to science, we know a lot more about substance use the last 5 to 10 years than we did anytime throughout history, because now we can see inside the brain. We understand more how it works. And we know now that this is a disease of the brain. And I'm going to explain to you more about what that means. And again, hopefully I'm going to challenge you all a little bit. I know you're thinking at Saturday morning at 9, I need to be challenged, but that's going to be one of my goals here, is to challenge the way you think about substance use. And we're also going to spend some time talking about youth and substance use or substance misuse. So one thing you'll probably notice right off the bat is I'm not calling it substance abuse. So that's been a shift that we tried to make in the field the past couple of years. Instead of calling it substance abuse, We're going to call it substance use or substance misuse. So that's just one little nugget for you today. But before we get started, I do want to talk a little bit more about bias. And when I'm training social workers, one thing that I always talk about is the big bad B word of child welfare, which is bias. But bias is real. Um, we all experience it, we all have it. And especially around substance use, bias is definitely there with all of us every day. So, when dealing with families who are struggling with substance use, when dealing with youth who may be struggling with substance use, it may make us feel sad, may make you feel angry. It's also going to make you feel frustrated. Okay. But everything that's happened to you in your life, your personal, your professional experiences, they're all going to impact the way that you view substance use. It could be things that happened to you when you were a child with your family, could be things that have happened to you an adult. It could be placements you've already had who struggled with substance use. It could even be news articles you read, or where you get your news from, or where you get your source of information. It's all going to influence the way that you view substance use. So as we're going through this class today, again, I'm really going to challenge you to kind of take your bias, to take what you already know, and to table it for about 60 minutes and try to come in here with an open mind. And even beyond this, too, whenever you're working with families, trying to take any bias that you have, trying to table that for a little while and trying to treat each family as an individual and treat each youth and their birth parents with an open mind. But still acknowledging that bias is real, but how do we table that, especially when talking about a subject like this? So, with that being said, I want to talk about our first myth. We're going to debunk a few myths today. The first one being that substance use is a moral failure. So I'm going to try to get you all involved in the chat a little bit. We're going to try to see if this works here. So let me know in the chat. Let's test this out. Have you heard that before? Have you heard that substance use is a moral failure? That's a choice somebody is making. Let me know in the chat if you've heard that before. Okay, Chris said yes. Okay. Anybody else? You heard that before. Substance use is a moral failure. Let's try this feature out. Hopefully we can use it a little bit today. Okay. If not, that's fine too. That's fine too. So, substance use being a moral failure. So, the reality is that substance use disorders are a disease of the brain. I'm going to talk to you a little bit more about what that means or why that is. So, the brain's reward system, um, we have this chemical in our brain called dopamine. That's basically our reward system. So, anytime we do anything, so it's whether we're in a relationship with somebody, we're talking to somebody, we make a connection, the brain releases dopamine. If we do something exciting, like we go on a roller coaster, the brain releases dopamine. If we eat a delicious meal like sushi, for example, the brain releases dopamine. If we eat something sweet, like last night, I had a lot of red velvet ice cream, so I had a lot of dopamine going through my brain. Um, the brain releases dopamine. Essentially, what that is the brain is rewarding us for doing something enjoyable and giving us dopamine to make sure that we are doing that again. So, if we have sex, for example, right, that's something that our body wants us to do often or to do more often or to continue to do to procreate. So, the brain releases dopamine. When we eat something good, it releases dopamine, and that's our body's way of saying, yes, continue to eat. That feels good. Unfortunately, what happens when we take substances are our brain is now going to be flooded with dopamine. So that natural level of dopamine that we got from eating food, for being in a relationship, for going on a roller coaster, our brain is now actually going to be flooded with that chemical of dopamine, and it's an unnatural amount, and it's too much for our brain to handle. So I'll show you all a visual of what that looks like. Okay, so here's just some comparisons of dopamine releases here. So you can see at the top, that's kind of our baseline of if we're not engaged in any sort of activity, how much dopamine our brain is releasing. You can see underneath that, you get a little bit more dopamine when you eat food. when you play a video game or like you're playing Candy Crush, or you're doing something like that, you get even more dopamine in your brain. It's that reward system. That's why a lot of those games are set up to give you a lot of mini rewards to keep you playing. If you have sex, you get even more dopamine than that. It's the pleasure, the good feeling, your body's way to tell you to keep doing that. And then hopefully you can see there's two examples there. There's cocaine and there's methamphetamine. And just kind of eyeballing it, you can tell that cocaine, you get about twice as much dopamine as sex. Methamphetamine, about 3 times as much, if not more, than from having sex. So you can see how quickly this can hijack the brain, affect it, and make it so somebody feels like the only way they can be happy or the only way that they can feel any sort of pleasure is from engaging in these sort of activities here. So our second myth is that stopping substance misuse should be easy. Okay, so you've also probably heard that before, right? Like, why don't people just stop? It should be easy to just stop using. Why don't they just quit? They're having all these issues with their family. They're having all these issues with their kids and the child welfare system. It should be easy for them to just stop using. Okay. But we just talked about the brain being hijacked. The reality is that for several different reasons, it's going to be extremely difficult to stop. Okay. The first one is like we talked about addiction in the brain. Um, the brain now, it feels like the only way it can really be happy is to engage in these substances. So before, it felt like from kind of normal activities like eating, from sex, all those things, it can feel pleasure, right? From swimming or from doing any sort of activity, it can feel pleasure. Now it feels like the only way it can be happy is to use substances. So now the brain's been hijacked, right? They're not getting that same level of enjoyment from normal things as they once did. You probably also noticed if you worked with anybody who struggled with a substance use addiction too, that they're not enjoying it, right? Maybe at first they're enjoying it, but later on, it's like they're just doing it as a way to feel alive or to feel normal at all, right? It's not really enjoyable after a period of time. The second point I want to make about why it's difficult to stop is because of withdrawal symptoms. And Chris, one thing I'm wondering, do you know if participants are they allowed to type in the chat? Because I had some prompting questions I wanted to bring in here, but if
Yes.
they are allowed
Yes,
to.
they're allowed.
Okay, okay. So hopefully we can get some more interaction here. So one thing that I want to talk to you about too is withdrawal symptoms. Okay, so you've probably heard that too. Well, what are withdrawal symptoms? So let me know in the chat if you have ever had the flu before. Let's try this again, get people talking in the chat a little bit. I would like to get some engagement, have some folks talking through the chat. I know you can't use your mics, but at least that way. Anybody here had the flu before? Chris said yes. Okay, Chris, you might be the only one talking to me today. That's okay. You can be my audience of one interaction that I'm going with here. Okay, but Chris said that he has had the flu before. I've had the flu before. My wife has had it recently. One thing we know about the flu is it makes you feel awful. It makes you feel terrible. And you would do just about anything to not have the flu anymore, right? Could be sweating, could be vomiting, can't sleep, fever, irritability, all of those things. Okay. Those are all going to be withdrawal symptoms too. So, anytime you've ever had a really bad flu, okay, imagine that's what someone is going through who's going through withdrawal symptoms. And sometimes it's even worse too, depending on the substance. So, for example, we know that heroin withdrawals are extremely severe. Some withdrawals can even result in death too. So, that's another thing to keep in mind. But basically, whenever somebody is going through withdrawal, there's an easy way to get somebody to stop going through withdrawals. There's an easy way if I'm going through withdrawals from heroin, there's an easy way for me to get all those symptoms to stop. And Chris, since you're the one typing to me here, Chris, what do you think the easiest way is to get somebody to get withdrawal symptoms to stop? What do you think the easiest way is? If I'm withdrawing from heroin, what do you think the easiest way to stop those withdrawal symptoms is? Quickest, easiest way.
easing down, from the drug. You can't exactly just go turkey with something like heroin. You would have to start a process of taking it down and working.
Yep. Yep. But you're exactly right, though. The easiest way, and thank you, Chris, for hopping on there. The easiest way to stop is just to continue to use. Okay. And again, if I have the flu, I would do just about anything to feel normal again. I would do just about anything. So think about that. If I'm withdrawing, the easiest way to get me to stop from withdrawing is to continue using. Okay, so that's another way why it's so difficult to quit, right? If I feel awful, if I just use a little bit more, it's going to make me feel a little bit normal again. Okay. Another issue too, or another reason why it's so hard to stop using, is because of oh, one more thing I want to add too about withdrawals too. So there's a lot of times people have questions about how long do withdrawals last too. So withdrawals can last anyway from a week to a month, and there's even something called post-acute withdrawal symptoms, or pause, it's called. Pause can last anywhere from there's been cases for people lasting anywhere from 5 to 10 years from having these withdrawal symptoms, right? So it affects your function, your functionality, your ability to remember things, um, to keep appointments even, to be able to walk in a straight line, to be able to talk clearly, to think clearly. It can affect all those things. And usually the it's the more you use, the longer those withdrawal symptoms are going to last. Not always, but that's kind of a good indicator. The more the amount you use, the longer the withdrawal symptoms can last. But there have been cases of people with these post-acute withdrawal symptoms that are lasting from anywhere from 5 to 10 years. So think about those families that you're working with, right? Again, it affects your brain function. So those people who are struggling to remember appointments, to remember visits that you're having with your foster youth, their brains might be being affected by the substances through those withdrawal symptoms. Okay. So I'll give you all an example of what I'm talking about here. While we all need reminders too, while we need to give grace sometimes. So from where I'm sitting right now, I can literally, and I mean literally, I can literally see my dentist office from where I'm sitting right now. Okay. In my home office, I can look out the window, I'll look around the corner, and my little neighborhood dentist office is over there. Okay. They will email me, they will text me, they will call me when I have an appointment, and sometimes I still forget that I have appointments, even though I can see the office and they send me all those reminders. Okay. So now take your families again who are really struggling with substance use. They're really struggling with their memory. Okay. It may be difficult again for them to get to appointments, to remember they have appointments, remember they have visits, all of those things. So sometimes, again, I'm going to challenge you a little bit here. It's important that we're giving our families grace as they're struggling with substance use, because it really is, again, a disease of the brain. Their brain has been hijacked, their reward system has been hijacked by the substances. So another reason why it's so difficult to quit is because of triggers. So you're all probably, as foster parents, you're all probably familiar with trauma triggers. Okay, there's also substance use triggers as well. And the dangerous thing about substance use triggers is that they are all around us. Okay, they are everywhere. I'll give you all a few examples of those too. What I mean by that. Super Bowl's coming up a week from tomorrow. If I'm somebody who's struggling with alcohol addiction, I'm going to be absolutely bombarded with alcohol commercials over the next week. Okay. Again, I mentioned I live in Raleigh. When I'm driving down 440, we call it the Beltway here, the Beltline here. There are billboards all over the place for alcohol. Anytime you turn on the TV, there's commercials for alcohol. Anytime you go out somewhere, you're going to see alcohol, right? It's going to be triggers for that. Triggers don't even just have to be media. Triggers can also be people. So maybe it's somebody that you used with, you see on a regular basis, that could be a trigger. A place can be a trigger as well. So it could be your neighborhood can trigger you. It could be family members. So a lot of times people use with other family members. It could be their friends. All of those things could be triggers and be a reason why it's so difficult to stop using. So you have to remember when families are coming home, or when families, well, if they go to treatment or they're getting treatment, yes, they're getting the treatment, but they're going back to a lot of the same environments where it triggers them. And you might be thinking, well, can't they, just be stronger than the trigger? Can't they just overcome that trigger? Can't they ignore the trigger? On some level, yes, we want to think that, but there's an interesting study done where they were able to look inside the brain and scan the brain of somebody who was addicted to cocaine. And they looked at his brain and they were showing him different images, and they were able to kind of see the activity in his brain as he was seeing these different images. And they showed him a picture, just a picture now. They showed him a picture of cocaine for a tenth of a second. They showed how long they showed him the picture for. It was like a quick flash of cocaine. And even him seeing that tenth of a second picture of cocaine, you could see his brain activity starting to go out of control. He wasn't around it. He couldn't see it. He couldn't smell it. He couldn't touch it. Even just seeing a picture of it for a tenth of a second triggered his brain activity. Okay, again, in those same kind of spots where we see addiction. So those are just some of the reasons why it's so difficult to stop using. So I said earlier I was going to challenge you a little bit. I was going to challenge you to think a little bit differently. So I know because I worked in the field, I've also had a lot of the same biases. I've also had a lot of the same preconceived notions. I know it's easy for us to say they should just be able to stop using. Okay. Hopefully, though, through this point in the conversation, you're starting to see it's a lot more difficult than just making a choice. There's a lot going on in the brain there that makes it extremely, brain and the body, that makes it extremely difficult to just stop using cold turkey. I'll pause there again. I know the chat's we're a little light on the chat here, but I'll pause for a second and see if anyone has any questions at this point. Because I probably just threw a lot of information there at you that you may not be familiar with. Maybe you are on some level, but I'll pause and give a second for any questions. Okay, so Tony said your chat option just popped up, so maybe chat wasn't available before. That would explain that. Thank you, Tony. I appreciate it. Okay, so that could be why y'all were so quiet before. Okay, so okay, so we're good now then. Okay, you just got
Sorry
chat.
about that, guys.
That's okay.
I'm
We're all learning. See everyone. Okay, I feel like you're all joining me now. Good. Okay. Okay. Good. 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 So, oh hey, Christy, I recognize your name there. So, any questions at this point then? Because I know I just threw a lot of information there at you. So Tawana asked, so good question, Tawana. She said, if you have clients who are unable to change their location, their people, what can you do to eliminate triggers? So that's going to be extremely difficult, Tawana. That's an unfortunate reality of addiction is that a lot of times we cannot change the triggers. So what I would recommend in that case is that's where their treatment is going to come in to play. That's where their treatment's going to really come in handy. I'm going to talk a little bit about treatment here shortly, but with treatment, one thing that they can focus on is how do you manage those situations? If you're offered substances, what are some strategies you have to get out of that situation? You might have to make some difficult decisions on people you're spending time with or people that you look at these comments are just all popping in now. Hey Joe. So yeah, they're gonna work on what are some different ways I can eliminate or I can eliminate these triggers from my life? Are there people I have to stop talking to? Are there places I need to avoid? And again, role playing, a lot of it can be role playing too with treatment. Role playing different strategies you can use to avoid that. There's also, we'll talk a little bit later too, medication assisted treatment, which is kind of a way to rewire the brain a little bit too. So their brain is not triggered as much by seeing these substances. And if I seem a little distracted at the moment, I'm seeing like all these comments now flying too. So this is great to see that I can see you all now. That's going to help the rest of the presentation for sure. All right. So good question, Tawana. Thank you for that. But it's difficult is the answer. All right, so our third myth is treatment won't work. Okay. So the reality is that there are multiple types of treatment, and it takes some people's attempts to stop using. Okay. I know, Chris. And Chris, Chris, you're being a very gracious host. I will say Chris got thrown into being a host late last night. So he got a crash course on how to use Socio. And Chris, I'm learning from you because I'm going to be hosting a session on supporting LGBTQ youth a little bit later this morning. So Chris, anything you learn about how to do this, let me know because I'm going to have to do this in a couple hours myself here. So yep, the it takes people several attempts. There's multiple treatments. There's multiple ways that treatment can work. So I saw somebody said having a support system. That's going to be a key one. There's inpatient therapy, so you've probably heard of that. There is detox. You've probably heard of that, which can be really important. There's rehab. There's group. There's family support, which I saw somebody mention. And I would really encourage you to think about the importance of family support. And I know that through shared parenting, that can be a way, depending on the situation, you can help with that. I'll explain why. So, one of the courses that I teach is about sex abuse. Another one I teach social workers about is substance use. So, sex abuse and substance use. Both of them have this same issue with birth parents. That when this happens to their family, they lose a lot of support. So if you have a protective parent in a sex abuse case, so you have the non-offending parent, a lot of people don't believe that they didn't know it was happening. A lot of times they get shunned, they get cut off from their support groups, which is really the worst thing that can happen to them in that moment, right? Finding out your child is being sexually abused by someone you know or someone you care about, and it happened without you knowing, is one of the worst things that can happen to you. But unfortunately, as a society, we tend to shun those people. We tend to blame them. We tend to cut them off. There's also something similar that happens with families struggling with substance use as well. Okay, a lot of times when you have individuals struggling with substance use, they tend to get cut off as well from people. And in a way, you kind of can't blame people too, right? They get frustrated because it can take so long for someone to deal with this issue. But the reality is, again, if you think about the brain being hijacked, they're kind of out of control, not able to make that choice. So, one of the best things in terms of shared parenting you can do is just be supportive of struggling or helping somebody with substance use. Yeah, build on their strengths. That's why those like Alcoholics Anonymous groups, Narcotics Anonymous groups, I've even been to Overeaters Anonymous meetings. They all kind of have that same message of people feeling like they're isolated and people feel like they're being cut off from everyone they know and they love because of their addiction. So that support, I saw that pop up in the chat quick. That support is so important for people struggling with substance use, right? I always think about too. I'll kind of give you all a cultural reference for this too. An interesting example I think about. If you've ever seen the show The Wire on HBO, right? That show's all about drug use, right? About drug use in Baltimore. And there was a character on that show named Bubbles, right, who really struggled with substance use. And his sister, there's a big storyline throughout the show with him and his sister, right? And his sister was so frustrated with him that she, basically cut him out of her life. He was really struggling. He was homeless. She eventually let him move into the basement at some point, right? I always think about that as like, it's such an interesting just cultural example of one small thing that she did to kind of give him some support and start to build that relationship again, just to kind of help him out a little bit. Um, Tawana said, any advice for when the kinship providers are also the parents' support? So, as a kinship provider, is that what you're asking? As a kinship provider, how do you still support somebody struggling with substance use? Like, if it's your sibling who's struggling, how do you still support them? I think that was the question. So, obviously, kinship care makes it, yes, okay. So, obviously, kinship care makes it even more challenging. I think sometimes as a traditional foster parent, you're able to take that kind of outside view of like this is somebody else. This isn't touching me personally as much as if it's your sibling maybe who's struggling with substance use. And you might take that more personally. You might have seen more of an impact it's had on you and the child. So Tawana, I think that was a perfect segue into what we're going to talk about next here. Um, Let's see, and I'm just seeing the chat here again. I'm sorry if I'm feeling a little all over the place. I'm just catching up with the chat. Okay. So here's a few ways. I think this is going to answer your question that you had, Tawana. So this is what's called the 7 C's. Okay. This is what this is the strategy we use to talking to youth about their parents too. So one thing when I was out in the field that I heard a lot was folks would make comments, they'd get frustrated, and kinship providers too would make comments like, your mom is choosing drugs over you. Your dad is choosing drugs over you. I don't know what's wrong with them. They would rather go get high than come in here and take care of you, whatever it may be. Okay. We really, really want to avoid that though. We really want to avoid that kind of messaging to children that parents are choosing drugs over them. It's not true. Like we said, it's more of a disease of the brain, right? We wouldn't say that somebody's choosing diabetes over you, somebody's choosing heart disease over you, right? It's a disease that they're trying to manage. It's a chronic illness they're trying to manage. Okay. So this is just a good little tip for families. The 7 C's. So these are just kind of messages to give to children whose parents who are struggling with substance use. I didn't cause it, right? Helping the children remind them they didn't cause the disease. They themselves, as children, they cannot cure it. They can't control it. But what children can do is they can care for themselves still. They can communicate their feelings. They can make healthy choices, and children can celebrate themselves too. So again, it's kind of shifting that narrative that I heard when I was in the field a lot of, let's not tell children that the parents just, making bad choices and choosing drugs over them. Um, let's kind of shift that message to it's nothing you cause, nothing you can control, but while your parent is getting better, you can still take care of yourself, and let's still talk and let's still communicate. Um, Relapse can change the family support group. Yeah, so I'm going to hit on a couple points in the chat. So one of them being relapse. Relapse is very real. Relapse is to be expected. It could take somebody several tries of going through treatment before it finally works. It could take somebody 5 times. It can take somebody 10 times. It could take somebody years before treatment works. It's really important that we do not give up on them. If I had more than an hour, which I wish I had with all of you, because again, this is like a 3-day training, in my opinion, to really get into the meat of all this. But one thing I like to do is show a video where a young man talks about that, how many times he tried treatment, it didn't work for him, and he was actually suicidal by the end of it, right? He was just so frustrated, felt so sick. He lost his son. He lost all communication with his family and everyone he cared about. But he had one friend that kind of stuck with him and helped him out. And eventually it was just like, man, you got to keep going to you got to keep going to rehab. You got to keep trying something. We got to try something. Eventually it stuck and he started to get better. And he talks a lot about how just that one person in his life who didn't give up on him, who kept pushing him, really saved him from killing himself because he was at that point. So sometimes you can just be that one person. So Jonathan asks, how do I support? So I would say you can support families with shared parenting who are struggling with substance use by just being empathetic, by not talking bad about them. If they miss a visit because they're struggling with substance use, right? Not being as blaming, still doing shared parenting that you would normally do. Um, just because there's a substance use issue again, I think just one way to support is still just talk to them like a human, still respect them, because a lot of people in their life have not. And Joe, you're exactly right. Relapse is normal and relapse is to be expected. Yep. Yep. And Tony, there's a lot of good reasons. That's why I'm saying it's hard to not blame somebody who wants to cut off family and friends who are struggling with addiction. Um, and it's difficult, and you're going to need to put up boundaries to keep yourself safe too. But it's really important that those folks struggling, they do have that support system there in place. Another thing I want to mention too about um, treatment, as you've probably heard before, medication assisted treatment or MAT. So that's going to be your like naloxone. There's different drugs, methadone that folks can use. So there's a lot of misconceptions about those as well, even in our court system. What those are basically are those are substances that are replacing their drug of choice or the drugs they're using. So I've heard some people say, well, aren't you really just replacing one substance for another? To that, I would say, in a way, yes, but you're replacing that substance with another substance that's going to let them function more. It's going to let them work. It's going to make them feel better. It's going to let them better care for their children. So there are certain substances that I need to take every day to function too, right? So I'll tell you all right now that I take an anti-anxiety medicine. I take it every day. It's just something I'm going to need to take the rest of my life to make me feel like I can function better, right? People take other things too just to help them function better. So when you take something like methadone, yes, it is a substance, but it's a substance that's not as harsh on the body and the brain as a heroin, for example. Okay. So it still allows them to function. People on methadone, people on naloxone, all those, they still go to work, right? They can still take care of their kids. They can contribute to society, be happy and healthy people who are just taking a medication to be able to do so. So, another way I'll challenge you is if you hear somebody is on medication assisted treatment, that's to be encouraged. And it's actually a North Carolina policy that social workers are not to discourage parents from taking the medication assisted treatment or engaging in medication assisted treatment. So we talked about the 7 C's a little bit, and hopefully, like I said, you have a little more information. You've been challenged a little bit to think a little bit differently about substance use and how it affects the brain, and think of it as more a disease of the brain. That was my first challenge to you all in our first half an hour of time together. Okay, I want to shift gears next a little bit. Hopefully, you understand the science behind substance use and start to think about adolescents using substances. Okay. So we're going to talk a little bit more about the impact that it can have on a developing brain. So I want you all to think about something a little scary here. We talked about the impact that substance use has on the brain of an adult. Okay. It could be quite damaging, could take years to recover. Now I want you to think about an adolescent's brain, a teenager's brain. Think about all that's going on with that under the most normal of circumstances. Okay. Then add in trauma, which we know most of our youth have. Then add in substances to a brain that's rapidly developing and this critical period of development here. You can imagine there's a lot going on here at the brain in this point, right? So, again, scary thought. Think about what we just learned in terms of with triggers, the brain functioning with the dopamine reward system. But now think about it with teenagers and their developing brains. Scary thought, I know. Okay, but here's what the trends tell us. And I'm glad you all can chat now because I had a few questions for you here. So, every year, the National Institute on Drug Abuse does a study where they talk to adolescents about their substance use trends. And we try to get a clear picture every year of what's happening. Okay, so let's go ahead and take a look at this slide here. I'll kind of explain it too. So, this was a study that was just done, just released a few months ago. So, it's the newest information here we have on the screen. For the first time in about 30 some years, there was a significant decline in adolescents using substances last year. For the first time in 30 some years, a significant decline. You can see it across the board. 12th, 10th, and 8th grade, they all went down significantly for the first time in about 30 some years. Go ahead and put it in the chat. Why do you think that is? Why do you think for the first time in 30 some years that it went down? Any theories on that? Okay, so Maria said the pandemic. Yep, you're on the right track. What specifically about the see, I don't see all the messages coming in now. I see them now. They're more at home with family, COVID. They weren't at school to meet them, isolation and stuff. Yeah, you're on the right track there. The theory is, Tawana, I wish I could say it's education. The theory is it's a lack of access, like Kayla said. So since they were home, they weren't around peers as much for the first time. Yes, they had less access to different substances being used. Yes, that's the theory. So what the National Institute on Drug Abuse, they thought that was pretty interesting. So they said they're going to put more resources into taking a look at that and saying, obviously access was an issue here and the use dropped significantly. On the flip side, though, use among adults went up because of the pandemic, probably as a means to cope. So again, if you have parents who are, your parents, like I said, at least 80% of parents involved in child welfare have a substance use component. I would say at least. Use among adults is going up though. So with youth, it went down. With adults, going up. All right, let me ask y'all too. Y'all work with kids all the time. In terms of trends, because they look at specific substances too. What substances do you think were going down, or what substances do you think youth are using less over the past couple of years than they previously had? Like, if we're looking at trends, what do you think's going down and youth are using less of? Any thoughts or guesses on that? Think about the kids you work with. Okay, so Desiree said pills, alcohol, marijuana going down. So, okay. Vaping, pot. Well, I wish I could say that y'all were right about that, actually. So what's gone down? Tobacco, cigarettes. Notice I said tobacco, cigarettes, and harder drugs. So those would be like your kind of your LSD, your heroin, those kind of things. So tobacco, cigarettes, and harder drugs continue to go down. Yep, Gail. Yep, tobacco, cigarettes continue to go down. I would guess that has a lot to do with education, a few other things too. Okay. What's going up though, are kind of the things you mentioned might be going down. So things that continue to go up. Vaping, marijuana, and alcohol continue to go up. So even though overall use is going down, we're still seeing more vaping, marijuana, and alcohol being used too. Yep, could be easier access. They're not as stigmatized. They're easier to get. Vaping was, advertised to teenagers for a long time too. I think there's been some restrictions around that now. They had different flavoring that would appeal to kids and all of that. So if you're looking at teenage use, that's very interesting to me too, as there's some things that are going down and other things that continue to go up. Right. And vaping, marijuana, alcohol, they've all been going up for the past couple years as well there. So why do youth use substances? Okay, well, I'm glad you asked. That's a great question. They use substances for a lot of the same reasons that adults use substances too. A lot of times it's going to be a coping mechanism. D8, D9, and D10 since they're all legal for 21 and up. Yes. Yep, Joe. So, why do youth use substances? Like I said, a lot of the same reasons that adults do. Okay, a lot of times it's going to be a form or a coping mechanism. Okay, so if you look at this kind of like a cycle, at first, you have your trauma that occurs. And again, most of our youth in foster care have experienced trauma, right? I think most of us would agree being in foster care is a trauma in itself, being removed from your home. After that trauma, 75% of youth might develop PTSD. Okay. We know about half of those youth with PTSD are going to misuse substances. Substance use could be a means of avoidance. So we see that a lot with youth who are sexually abused, physically abused, neglected, all those things. They might turn to substances at first as a way to avoid a situation, or it could be peer pressure. I saw somebody use. It could even be normalized in their family as well, too, right? I'll share, I grew up in a home where drug use was in some way kind of normalized in my family. Okay. So you could see it depending on your home, and some of you are probably nodding because it could even be alcohol. Maybe it was normalized. It could be marijuana. It could be harder drugs. Were just kind of normalized. Something you saw, something you smell, or something you experienced on a regular basis. Right. That's not totally unnormal for youth that we're working with too. And when you're using substances, there's that greater chance of engaging in high risk behaviors, which again could lead to more trauma. Okay, so you kind of see this vicious cycle of youth using substances, right? It's a lot of the same reasons again that adults use too. It's this kind of vicious cycle of trauma and then trying to self-medicate and then the trauma happening again over and over. So you need something to help break that cycle there. All right, so I have a couple more activities here that are going to be a little more interactive for you all. I see we have a little bit more time left. One thing I think too, as foster parents or professionals, it's going to be important that you recognize some different paraphernalia too. So if you see it in your home, we get a lot of questions about this, like, well, I'm not as familiar with substances as somebody else. I don't know what this looks like, or sometimes kids can kind of sneak it through a little bit too. So I have about 8 different pictures here. This is going to be kind of a test we're going to take together. I have about 8 different pictures. I'm going to pop up on the screen one at a time. I want you all to let me know in the chat if you recognize this and let me know what it is or what it might be used for. And some of the things may look a little more innocent than others, so it's important that we're aware. So here's going to be your first one. This one might look familiar to some of you. All right, what's that a picture of? Let me know in the chat. Or what is that used for? Yep, see, bong, 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 weed. Yep, so if you see that, that's kind of an easy one I gave you to start with, right? So that would be a bong if you're not familiar. If you didn't grow up with parents who went to Woodstock like me, you may not recognize that one as much there, but yes, that is a bong, usually used to smoke weed. So that's kind of an easy one we're starting with here. All right, here's your next one. What if you see your youth with a few of those laying around? What could that be? Not necessarily again, but what could this be a sign of? Again, it's something that could slip under the radar a little bit on you if you're not paying attention. What's that a picture of, or why might that put up a little red flag for you? Nope, not vaping. Yep, Desiree got it. Yep, could be huffing. So like an aerosol can could be a sign of huffing. So a lot of times teens might use those because it's easy to get to and it's kind of something that you can sneak under the radar. But if you're, like huffing, they call it aerosol or inhaling the aerosol, that can cause pretty significant brain damage. Obviously, yeah, Tamara said taking the tops off to inhale. Desiree said, yeah, the paint can, all those kind of things. That can cause some pretty quick, significant damage. And it kind of gives a high similar to being dizzy, like if you spin around a lot. It's kind of like that, just turned up a few degrees. But that's something kids can easily access and again, sneak under the radar. So be mindful of aerosol cans too. If you notice your youth has those for some reason, you're not sure why. All right, here's your next one. What's that a picture of? Somebody mentioned it earlier. Yep, so that would be a vape. Okay, so if you've never seen vape pens before, that's kind of what they look like. I usually see, like, if I go to the mall or something, you see a lot of like teenagers vaping. Again, vaping was advertised to teens strategically, and it was kind of first marketed as a way to a safe alternative to smoking, which we now know is not necessarily true. There's still a lot of research being done on vaping, but there's different chemicals that are involved in vaping that we're not sure the kind of damage it can cause, but they're pretty sure it causes damage. They're just not sure how yet. But vape pens can look differently. They can look like this. I've also seen ones that can look like thumb drives. So it could look like your kid's doing a school report and it's really a vape pen. I've seen ones that look like pens, like you'd write with, like an ink pen. So there's a few different ways that that could be a little tricky to recognize. Just know that there's still research being done, but the thought is that they are not a safe alternative to smoking for some different reasons. All right, here's your next one. What if you see that laying around? What could that be? I think that's a pretty obvious one. If you see that laying around, that could be an indicator to you that your teen might be into something they're not supposed to be. Really, just a syringe of any kind, right? Could be up, shooting up. So injecting something to themselves too. I'd say another one. Yep, could be heroin. Another one to keep your eye on too could also be steroids too. So I kind of put that one on there, thinking about steroids too. So there's some obvious peer pressure among some teens, especially if they're into athletics or anything like that. So just be mindful of like anabolic steroids or anything like that too. It could also be harmful. All right, next one. You all know what that's a picture of? Are your kids just into gardening, or what's that look like? Again, it's good to know what these things look like in case you come across them. Yep, that would be marijuana. So, it's kind of that leafy kind of looks like grass. So be mindful of that. Good. All right, y'all are getting this. We'll go a little quicker now. This one again is a little more obvious, but again, if you haven't seen it before and you find like a spoon with some burn marks laying around your house, I want y'all to be mindful of that too. What could that be an indicator of? Like a spoon with some burn marks on it. Yep, could be crack, could be heroin, it could be a few different things. But if there's any sort of spoon burning, so heroin kind of looks like a little brown, like sticky substance. That's why you might hear there's even a type of it called black tar heroin. So it might look like kind of a black sticky substance or brown sticky substance. Good. Again, though, youth typically don't use hard drugs as much. That's more adults, but it's still good to know if you find that in your home. All right. Now, what if your child, you just bought them a new Bic razor that they're starting to grow in their little beard? Like teenagers do, they get their little goatee and all that. But you bought them a little Bic razor, but you still see some of these laying around. What could that be a sign of? You're like, I know my kid's not using a straight razor to shave themselves, right? This isn't a barber shop in the 1840s. What are they using the straight razor for? Right. That's oftentimes like cutting up like cocaine or it's sniff or to cut drugs. So if you find some of these straight razors, again, that could be an indicator. All right. And then the last one, this one usually trips people up a little bit. Can prescription drugs still be harmful? If you find some pill bottles. Sarah said you never knew how much 90s movies taught you. Good, Sarah. Yeah, pills. Yes. These pills can absolutely still be harmful. So a lot of times you'll hear like, "Oh, we're in the opioid epidemic." What does that mean? Okay, here's the thing about prescription pills, like painkillers especially. Prescription pills have a very, very similar effect on somebody as heroin. So if somebody is misusing prescription pills, they're essentially using heroin. And Desiree said that's where many people get started. Yes. So I've seen statistics saying as high as between about 70 to 80% of people who started using prescription pills turn to heroin because it's cheaper and easier to get. Okay. So you're exactly right. That's where a lot of people started. So when we're talking about the opioid epidemic, we're also talking about prescription pills. So just because it's a prescription pill, it's a painkiller, it has their name on it, it doesn't mean it can't be misused. Because if it's being misused, it's having a similar effect on the person as heroin. So don't overlook if they're misusing prescription pills. They're essentially using heroin. Okay. So keep that in mind too. Yep, you can OD on pills. A lot of people have, a lot of people do, unfortunately. So just keep that in mind. Just because it's in that nice little bottle and it came from Walgreens doesn't mean it can't be harmful. All right, and I knew I'd run out of time because I could talk about this all day. I got one more little activity that's important for you all too. So another thing too is to think about slang. Okay, so again, if you're monitoring the youth in your care, it's important to know the slang because it changes. There's a few different ways you can learn about it, right? You can ask teens, listen to music, watch TV, right? Even like, slang funny example I give is like Netflix and chill. If you haven't heard that, that was like slang for like let's come over and have sex. But if I know about it, it's probably not what kids are saying. It's probably not the cool thing to say anymore. But it's important that you're all familiar with slang as well. So if you're monitoring technology, if you hear them say something, you're aware of some of the slang. So I got a couple minutes. Let's go through a few of these quickly. Let's skip alcohol. I think y'all know alcohol slang. Marijuana, you probably know. Cigarettes. I don't know if we have time to go through all these, but I was gonna have y'all list some slang. That's always kind of funny just to hear it. What y'all came up with. Chris said you have 6 minutes. Okay, I want to save time for questions though too. But with slang, though, again, make sure you know what kids are saying for slang, right? Alcohol could be booze. I don't even know if kids are saying booze anymore. Marijuana, typically weed, something like that. Heroin, smack, lady H, dope, crack cocaine could be bump, powder, rail, cigarettes, it could be Lucy, prescription pills, you might hear it called like Oxy or Whites. There's a lot of different slang. So with slang, I would just say be aware of what it is, right? Because it's going to change. If I would say if you know it, yes, scissor or syrup, right, which is like taking cough medicine and misusing that. Dynamite. So there's a lot. See, I've never heard dynamite before. You're always learning. Primo, okay, yep, see? There's so many different slangs for all of them too, and it might depend on where you live. Yep, so Molly, Molly's another one too. QP when talking about weed. So Tamer, I don't even know what QP is. So Molly is the same thing as ecstasy, if you're familiar with that. That's like a party drug that increases the sex drive. And really, I just bring this up again. Know as much slang as you can if you're taking care of kids. Okay, so Desiree said dynamite's a combination of drugs, which, yeah, that's obviously very dangerous when you're mixing drugs together because they all have a different impact on the body. Okay. My time is running short. I'm glad we got the chat working. I'm sorry it wasn't working in the beginning. Absolutely no fault of Chris. Chris, thank you again for hopping in. You got thrown in here last minute and asked to help with us. So Chris, thank you for hosting. If I could just leave you all with a few messages though, and I knew I threw a lot of information at you. I would just say please remember substance use is a disease of the brain. Do your best to educate other people about that. It's not a choice. It's not a moral failing. It's a disease of the brain. The person needs treatment. They need support, and they can get better. If you take a look at like a cross section of a brain of somebody who is using methamphetamine severely, their dopamine receptors are all going to be burned off while they're using. After a couple years, though, the brain heals and the brain goes back to normal. Okay, so unfortunately, as a society, we've shunned a lot of people. We've blamed a lot of people for substance use. And yes, they did make a choice to use it at first, but it doesn't take long for that substance to take over the brain, to hijack the brain. Okay, so have some sympathy, have some empathy for your families, and please, if you could take one message from this course when talking to your youth, like if you have a foster care placement in your home and their parent is struggling with substances, please, please, please don't make it a situation where you're blaming the parent. Okay. Please talk to the youth in a way that they understand that their parent, age appropriate, has a disease or a sickness that they're working through. Okay. We don't ever want kids to feel like they're responsible or they have to take that burden on of it's their fault. So remember those 7 C's too. You can Google 7 C's and it should come up too. So hopefully I threw a lot of information at you all. Yep, they love their families no matter what. Absolutely. Absolutely. I got a couple minutes left. Any questions that you have I can answer quickly? Any questions you want to drop in the chat? Just continue to as you're typing questions, continue to educate yourself on this because the science is coming out more and more all the time. And hopefully I was able to challenge you all a little bit here on a Saturday morning and think differently about substance use. Absolutely. Thank you, Nicole, and thank you, Tony. Just continue to educate yourselves and have patience. Those will be my closing words. All right. I think I'm all set, though. So I think you guys have another session coming up. I'll give you a moment to get over there. But thank you all so much again. And I work at UNC School of Social Work and the Family and Children's Resource Program. You can find us more there. And I'll put my email in the chat if you have any questions you want to ask me later. But thank you all very much. Thank you all for what you do. You are unsung heroes. Stay safe and stay healthy. And hopefully, I'll see you somewhere else in the summit. Take care.
That was a very good, informative session as you with the chat. You that in the regular chat.
You're cutting up there a little bit, Chris, but yeah, I see some thank yous, and I saw your message there too. Joe had a question. So Joe, I don't know if you can still hear me. Joe asked, I'm not sure who's still here. Oh, I put in the private chat my email. I see. That's the private chat. So Joe asked the best way to approach youth if they're using in your home. So I would say definitely get a professional involved, Joe, but try to have open, honest communication with them, try to talk to them about it, and then try to intervene with a professional if you think your youth is using. Because if a youth starts using, they're more likely, if they start when they're young, they're more likely to become addicted as they get older. So Joe, if you can still hear me, that's what I would say is try to nip that in the bud as early as possible. All right, Chris, are we done?
Yes, sir. That concludes the presentation. And again, thank you, Mr. Rockoff, for your wonderful presentation. As you see, people are very appreciative. And we look forward to seeing.
Okay. Thank you, Chris. I appreciate it. Thanks for hopping on last minute here and helping us out.